Well, welcome back, friends. It is the Just Starting the Conversation podcast, and it is brought to you by St. Luke's University Health Network. My name is Kevin Crockett, as always. Thankful that you're joining us today. Wonderful conversation ahead of us today. Always excited to kickstart another one with one of my partners in crime, Amie, Alanson, Dundon. Amie, how are we? How are things?
Things are good, Crockett. Thanks for asking. I'm excited in early 2024 to be rocking and rolling with you and excited to have a great guest here today.
Excellent. And I'm excited as well. And it's important that Tina does know that we don't just rock or just roll. We do rock and roll. Both of those things are going to be accomplished today. She is Tina Clymer. She is an administrator for the Carbon-Monroe-Pike Mental Health and Developmental Services. Tina, thank you so much for joining us. I have to say, we talked off air. This is your first podcast, so congratulations to you. Welcome. We're so happy that we could be the first one for you.
Absolutely. Thanks for having me. I'm looking forward to it.
You're very welcome. Amie and I have already discussed that there's a little buzzer that Amie has that anytime she wants to just give you a shock, make sure you're checked in.
We all need that once in a while.
Yeah. I feel like this is gonna be a good first date.
It is. Yeah. It's like we're all just sitting down at the restaurant together here.
Right.
Well, listen, ladies, we do have a very serious conversation ahead of us today. Obviously, this is a mental health podcast, and the conversation today is going to be around the 988 program, resources, what to know about the 988 program. So, Tina, I'm going to go ahead and kickstart with you. For people that aren't familiar with 988, what that means, what is the 988 program?
So the 988 program has often been compared to 911 for physical health issues. It's a little bit different. 988 is a number that anyone across the country can call if they need someone to talk to or are experiencing a mental health crisis. So it's really a great option for people. So I don't know what to do. I'm having a hard time. I'm struggling. You can call 988 and they can help direct you where to go. Or if you're experiencing a mental health crisis and you're struggling even more so, thinking about harming yourself, needing someone to talk to, they have trained people on the other end of that phone that can actually have a conversation with you and walk you through the crisis.
Yeah, can I just jump in there, Crockett?
Of course.
I think some of the history is really interesting with the 988 program. It was really just implemented officially in the summer, in July of 22.
Right.
So it's summer of 22. So it's really new across the country. And calls are directed. A lot of people are like, well, if I dial 988 or I call 988, where does that call go? Mm-hmm. And I think it's interesting to kind of know that that call goes to a local crisis center, right? And this is all over the country, right? And then if that call is not answered in 60 seconds, that call then goes to a regional crisis call center. And then if there's the need to further advance it from the regional, it goes to a national crisis call center. So while 911 centers are really big for our medical stuff, 988 is just kind of in its infancy. But the system that the states have and the government has is really nice and fail safe, and there's a lot of different layers with trained crisis workers if you're in a mental health crisis situation, which then certainly brings up the call, well, what the heck's a mental health crisis? Right. How do I know?
And just in Pennsylvania specifically, that we're using regional call centers. So, and the nice thing about that local aspect of it is they know the resources in your area. And I know that the whole system is working to make sure that when you're identified it's just by area code, that they know the resources in that specific area to refer you to for ongoing stuff.
Yeah, for sure.
You mentioned that this just came about in 2022, and I can speak for myself and say, based on being naive, probably 988. When I hear it, I always thought it's just the suicide prevention line. This is more than that. We talk about a mental health crisis. This line is more than that, obviously, right? There's a bunch of different services that you can services is the right word, maybe not the exact right word, but it is beyond a suicide related crisis line, correct?
Sure. It took well, I don't want to say took the place of, but it kind of took the place of the suicide hotline.
Mm-hmm.
It became that. But, really what the attempt was is that folks that are experiencing a mental health issue of any sort can go the 988 direction and not necessarily need to go the 911 direction. But I think it's really important that people understand that if you're not sure and you're obviously someone you love, or you're in the middle of a mental health crisis, 911 will get you to 988. So, don't feel like, well, I can't call 911, because 100% you can.
You can. And I think that what everyone's trying to do with 988 is take the police out of mental health crisis, not because they don't do it well, because they do. There's a lot of training that is going on with police officers, but they've got their hands full with other things, and people with a mental health issue sometimes get upset when police get involved because it's not criminal. They're not doing anything wrong. So we want to try to separate that and use police and EMS, for that matter, only when it's necessary. So if people are having a mental health crisis and they call 988, the only time police or EMS would be involved is if they need to get to the hospital, or if they're in imminent danger, or someone else is in imminent danger. So we kind of wanted to take that aspect out of it with 988. And there's always been suicide prevention hotlines and local crisis lines available. But 988 is that simple number that you can remember, and it's across the whole United States. So I think it helps people to know what the resource is. Oh, I have a mental health crisis, let me call 988.
Yeah. I think, when we've on this podcast, we've talked about police involvement, and we certainly want and need police involvement, and a lot of them are crisis trained, and that's a fantastic thing. But the numbers are staggering in terms of the people that are experiencing mental health need and crisis. So county crisis teams are specifically trained to respond to crisis calls. So anybody can call their county crisis line and have a team kind of come out and do a check. It's just another layer, I think, which is important.
Yeah, and I think 988 is a piece of what SAMHSA, which is the national gurus on mental health, their vision for mental health, and that 988 is the first step. So we want to be able to have someone to call, someone to come out and see you, and then someplace to go. So it's kind of a package deal. So when you call, that you can talk to someone. If you need additional help, mobile crisis teams can go out. And then if you need additional help at the moment, there's a place you can go besides a hospital, although that's an option as well, but crisis centers and crisis walk-ins. So there's a vision of moving mental health crisis services forward across the country.
Yeah. And one of the cool things about 988 is that it also has when you call 988, there's a special option for veterans.
Yes.
So if you're a veteran through 988, you can get specialized help. And it has a Spanish option for language need. So it really has tried to cover all the bases.
Well, listen, I think that this is an amazing resource, and the fact that it just came about in 2022 is kind of staggering, even for us doing a mental health podcast to talk about that. But some of the things that you alluded to, we mentioned police, we mentioned, if you need a hospital stay, if you need people to be dispatched. With things like this, I think that sometimes maybe there's some information that is misinformation, as is with anything. Amie, I guess to kind of start with you, when it comes to a line like this, I could see we've talked about whether it be for financial reasons, maybe it has to do with your history. Different times we've talked about maybe sometimes when needing help, you might not do it because of X reason. And a situation like 988, it sounds like really is a line that could be helpful and supportive in so many ways. Are there any sort of negative, I don't want to say negative, misinformation is the word that I'll come back to again, that maybe it could be holding somebody back? Oh, I have to pay for this service. I don't want the police to show up. I have a history here or there, or whatever the case may be. Just some of those maybe kind of things that might keep somebody back for a second from doing this, that you could say, no, this is a positive thing for you to do. Here's why you want to do it. Here's how it could be helpful. And there's just some misinformation out there.
Well, I think number one is that often people get scared and think, well, I'm not really bad enough to need to call 988. Right? It's not, things aren't that bad yet, or I don't know if I'm having a mental health crisis. So I think the first thing to know is that if 988, if you're experiencing certainly risks of hurting yourself or somebody else, or somebody in your family that's a definite, right? But, you can feel like you're in a crisis situation today. I could feel like I'm in a crisis situation. Tina could be experiencing the same thing. You could be experiencing the same thing, and we would have different needs around that. So it's always okay to call 988 and check it out. If you feel like, gosh, I've been depressed for so long, I just can't shake it. I've tried to get into therapy, and I'm maybe on a wait list, and I don't know what other resources are out there. It doesn't have to be a, life or death situation necessarily to call 988.
Yeah, I think it's always better to call really for any reason, and then the folks on the other end of the phone can direct you in a different on a different path if it's not the right one. But like Amie said, a mental health crisis is defined by the person who's in crisis. So it could be the loss of a pet for one person, and it could be suicidal ideation for someone else. So that continuum of what defines a mental health crisis is so broad, and it's always better to get help early on than to wait. It's never not enough to make a call.
Yeah, and I think, some of the things we need to think about are, well, what are some warning signs of a mental health crisis, right? How do I know if I'm headed that direction or I need to call 988? Well, inability to perform daily tasks. Are you eating? Are you sleeping? Are you showering? Are you brushing your teeth? Have you been brushing your hair? All of that is a sign that maybe something may be starting to go wrong. Any
isolation is a big one.
Huge, right?
Yeah.
Rapid mood swings, pacing, being really withdrawn, increased agitation, verbal threats, violent, out of control behavior, abusive behavior to self or others, or if you're in a domestic violence situation.
Right.
Any of that, all of that should be kind of a warning, right?
Yeah, there are so many different ways that mental health crises or mental health issues manifest themselves. So I think anyone who's thinking, should I call? You should probably call.
You brought up, I think about, Amie, a situation where you said it could be a domestic violence issue. Can I text 988? And if that's the case, what kind of response will I get from texting 988? And even if it's not something that's such a situation that's so perhaps, in a moment, trying to obviously maybe not have a conversation because of someone else being in a room or close by. If I want to text 988 just because maybe I'm a shy person and just trying to put my toes in this water a little bit, maybe before making a phone call, can I text 988?
There is a text line for 988, and texting has become a big thing for mental health crisis, just for that reason, because sometimes people are leery of the engagement, so texting is a better option for them.
This might seem like a really, I'm sure probably particularly to you two, I don't want to say an annoying question, but one that I'm sure you've thought about quite a bit. What the heck took so long for this to come around? I mean, we're talking about 2022. For both of you that are trying to help people with dealing with a mental health crisis. It feels like this kind of should have been a no-brainer a long time ago. So, Tina, I'm actually going to go ahead and start with you and ask it in the most polite way that I can. What the heck took so long?
So, I don't really know the answer to that question. I have a lot of thoughts on it, though. I think that really pulling it's a huge project, and getting that off the ground nationally takes a lot of people to agree on things. There's funding issues. There's still funding issues behind 988. I know there's talks in different states about taxes, much like the 911, to continue the funding. There's training. There's telephone issues. I know locally with our 988, there were some telephone issues and the calls had to get switched to another center for a while. So there's a lot of technical stuff behind it as well. And then in addition to that, there's some turf war stuff kind of thing going on, because counties have been doing local county crisis since 1967, with the Mental Health Act of 1966 started. So we've been doing that, and a lot of counties are very fearful that it won't get done right. They won't know the local resources. But honestly, a lot of work has gone into making sure they do. But there's a lot of question, and we don't want to confuse people. What number should they call? So there's a lot of reasons as why it took so long. Maybe none of them good, but there's lots of reasons.
Yeah, and it seems to come down to funding a lot.
Funding is always at the top of the list for most issues and challenges in the behavioral health world.
Yeah. I think this is absolutely a great why did it take so long service to have. But I think it's also important that, in everybody's county, you should check and see what resources you have, because there's a lot out there that you may already have access to and you just don't know it. Mm-hmm.
Yeah, there are tons of resources. We always need more. I'll put that caveat out there, but there are lots of resources in local communities, and I think that the best thing to do is to check out your county, or some states don't go by counties, but your jurisdiction, is to check out the website and see what services are available. Like I said, the national map for crisis is really ramping up. And I know in our small Carbon County area, we worked with St. Luke's and recently opened a behavioral health walk-in center that people who are in behavioral health crisis can walk into that center and get services and intervention right there. And that's little tiny Carbon County. So the services are just growing.
Yes, and to piggyback on that thought, we've had police who there's been a 911 call, and it ended up being a mental health issue. We've had police bring folks to the walk-in center.
Yep, that's ideal. It's wonderful.
Which is ideal. So you're not going to get in trouble. There's no arrests. Right. If you meet criteria that you don't necessarily have to go to a hospital emergency department, they could take you, or your loved one could take you to a walk-in crisis center, and you're going to get that psychological crisis worker intervention and referral to appropriate care, at that moment. So the resources like our walk-in center are invaluable.
Yes,
for sure.
Yeah, the walk-in centers, mobile crisis, local telephone crisis centers. There's partial hospitalization, which is a weird name, but it's like a day program where you go and get your behavioral health services. It can be once a week, it can be 5 days a week, but the clinical staff, the psychiatrists, are all on site, or sometimes telehealth nowadays. But it's a whole program to help you get back on your feet following a behavioral health crisis. So that you can integrate back into your normal everyday life. So there's a whole continuum of services available. Now that varies depending on where you are, but I always encourage people, even if you think there's a waiting list or you're not going to get the service, to ask for it, because that's how we know what the needs are. And sometimes it's just folklore. That there used to be tons of waiting lists and you couldn't get services. But the mental health system has developed so much over the last few years that people would be surprised what services are available.
Amie, we've talked quite a bit on this podcast, not only about the individuals, but the people that are close to them, their family, their friends. If I'm a person who's maybe seeing someone close to me struggle, we've mentioned local resources, we've mentioned 988. Where would you kind of suggest starting? Is it a situation where if I'm a concerned family member, I'm calling 988 myself and trying to hand over a phone and saying, hey, can you just talk to somebody? Or, you mentioned local, we keep saying Little Carbon County, but a big shout out to the Carbon-Monroe-Pike Mental Health and Developmental Services Center for teaming with St. Luke's and giving a facility for this. And like you said, there's situations where it's an open door where police will come and drop somebody off and just kind of let you know you're okay. They're going to take care of you from here. Mm-hmm. If you are a concerned person, a family member, a mother, a father, brother, sister, whatever it might be, friend, you're a concerned friend. When it comes to this idea of 988 or a mental health crisis center, or kind of just where would you, again, different circumstances are different circumstances, but where's a good spot to begin?
Well, I think, if you don't believe there's immediate danger, then you could call, if they have a psychiatrist, call their psychiatrist, their clinic nurse, the therapist, case manager, family physician is always probably a really great place to start, their PCP, their pediatrician, and get their team, if they have a treatment team, get their team on board. Those professionals can really help assess the situation and then offer advice about obtaining appointments and what have you. NAMI is always another great resource. National Association for Mental Illness. There's local chapters. They have, you can as a concerned family member, you can call them to get resources. But yes, anyone can call 988. If I'm concerned about you, Crockett, I could call 988 and I could say, I have a friend and here's what my concerns are, and they'll guide me and they'll help walk me through maybe what are some good options for me and how do I help my friend. Just things like helping you to learn how to de-escalate somebody, or give you the tools that you might need.
Yeah, I think it's a good tool, whether it's 988, your local crisis, or your local mental health center. If you're a concerned friend or family member, you can call, and there's great training out there for the general public with mental health first aid and QPR, both de-escalation and suicide prevention programs. I know in our counties they're free to the public, because you can experience anyone, even people you don't know in the community who may be having a mental health crisis or maybe just struggling with mental health issues. And it's basically just how to intervene, even though you may not be the person who's solely responsible, to help that person get to someone who can help them.
Yeah, and QPR, just because people may not know, is question, persuade, refer.
Right.
And it's it's one of the newest, most evidence-based tools in terms of learning how to deal with somebody who is in a mental health crisis.
Right. Yeah, and it's a lot of times it's a simple hour and a half course that helps people learn what to do when they encounter someone who's struggling.
Sure.
Excellent. That's excellent information right there. So we've come a long way. Okay, 2022, 988, the hotline gets set up. Tina, I'm going to start with you on this one. Where would you like to see the world of mental health crisis go from here? What you're both left, and I understand funding and all of those things are part of that equation, and I understand. But one step forward could lead to another step, could lead to another step. So just kind of in that space, the mental health crisis space, for you, where would you like to see things go in the near future, far future, just kind of what that next step might be?
So I have lots of visions on where I'd like to see the mental health system, including crisis, get to in the next couple of years, well, maybe 10 years. But I would really love to see us be able to have centers where in every county, well, I think Pennsylvania, but really across the country, that if someone needs mental health services, they can walk in, just like an urgent care or immediate care center for physical health. I think it's really important that we put mental health on the same horizon as physical health is. So I think having that ability to walk in and get services regardless of insurance is really where I would love to see crisis and ongoing services get to for behavioral health. I would like to see every community have access to mobile crisis services, where if you call crisis, a team can come out, engage the person who's struggling, and help them get to the resources they need so that they don't have to be hospitalized, and so that they have those ongoing services to avoid crisis in the future. So that's kind of my vision. Funding is a big thing. Mental health parity and insurance parity is a big struggle. Private insurances don't pay for crisis services in a lot of respects. They say they do because they think they do.
But they don't.
But they don't. They pay for ongoing services. Most people have a high copay for that.
Oh, yeah.
But they really, truly do not pay for telephone, mobile, and walk-in crisis.
Right, so then counties get stuck.
Yes.
So counties get stuck footing that bill, or organizations like major health and hospital networks get stuck just eating it and saying, well, we're not going to get paid, but we're going to provide the service anyway because it's the right thing to do.
Yeah.
And then how is that sustainable?
Yeah, I think it's a big issue that a lot of people don't think about. They think, oh, if people have private insurance, they have access to more services than people who are uninsured or who have Medicaid or Medicare. And it's simply not true. Or they may have access to the services, but the services don't get paid for.
Yeah, but that being said, I don't think people should say, oh, well, I have private insurance, so I'm not even going to try. No, don't do that. But I'm saying on the back end, that's why it's hard to sustain, because it's just, there isn't the parity for reimbursement and for finance.
Yeah, so I guess that's my other
Wish.
vision and wish is that not only mental health crisis, but all mental health services would be adequately funded through the government, through private insurances, because I think it's just overlooked. And you can get most surgeries done through your private insurance or through Medicaid, but getting a mental health crisis paid for is a problem.
Yeah.
It doesn't make sense to me.
And I think you're right. It comes down to access.
Yes.
That's really what, it's the beautiful thing about this walk-in center that St. Luke's has in Lehighton, Pennsylvania, where you can it is basically a psychiatric urgy center. Mm-hmm. And it's a beautiful, beautiful model. And wouldn't it be lovely if it was financially supported in such a way that it could be replicated all over the state?
Right. Yeah. That center it's interesting that came through ARPA funding from the pandemic, and we're St. Luke's and Carbon-Monroe-Pike Mental Health and Developmental Services. We're trying to develop a rate, but it's a Medicaid and a county paid service at this point. So we're fingers crossed, doing everything we can to make sure we can sustain that service and keep it in the community once that ARPA funding is all gone.
Yeah, and we're seeing and treating everyone. It doesn't matter what your insurance
Yes.
is, but that access. That's, we need to make it easier for everybody to have the care at every level that they need for mental health and substance use treatment.
Yeah, and I think that's something that people need to think about, is that if we get people services, even if it's at the crisis level with a walk-in center or a mobile team, if you get people services at that level, even though it seems super expensive, it saves money in the long run because they're staying out of hospitals. Police aren't going out to the scene, and every time police respond and EMS respond, it's additional funds that get spent. Where if we can keep people stable and get them the services they need ongoing, the cost for mental health treatment goes down quite a bit. So saves money in the long run.
Excellent stuff there, ladies. Well, certainly, again, it took a while to get to this point, but the 988 hotline is here, and hopefully I'll cross my fingers for both of you. I think you guys use the word wish, but I'm going to use the word vision. So we're going to speak this one into existence. Not a wish, but your vision, certainly, sometimes in the next few years. can start to come to fruition. Because like you said, Tina, the physical and mental health, kind of getting them on the same level. You mentioned you can go and get a surgery on all different types of insurances, but trying to go and get your mental health taken care of can have some different hurdles that maybe those physical injuries don't present. So, Amie, I'm going to give you the chance, if there's anything that we missed throughout this episode, if there was anything else that you wanted to touch on, and kind of give you your spot here, if there was anything else. But I think we had a really excellent conversation today talking about the 988 hotline.
Yeah, good stuff. I just want to thank Tina for being here and for all that you're doing through Carbon-Monroe-Pike mental health and all the help that you guys give St. Luke's. And it's a joy to have you here today. And I thank you again.
Oh, thanks for saying that. Great partnerships.
Yeah, for sure. And that's what it takes, right? I just think if you're not sure what to do with your mental health issue or your loved one's mental health issue, don't not do anything. Do something. Call the family doc. Call 988. There are services there, and that call, while it's really difficult sometimes to make that first call, that could change the rest of your life for the better. It's one call, and there's help there. So I just want to kind of leave with that point.
Yeah, no issue is permanent. Things change for the better. So I think it is so important to make the call. To reach out. People, you're not alone. Like, we all struggle. So just pick up the phone and call for help.
I think that's such a great way of putting that, Amie, is don't do nothing. Yeah. Find something, it sounds like such a, it's not the most wise statement that's ever been given, but certainly when it comes to talking about your life.
Pretty wise.
No, you know what I'm saying? I'm saying it was wise.
I'm going to get a T-shirt. I'm going to print it on a T-shirt.
I think it would be a great T-shirt, because while most people would, the allusion to it is that it's like, what kind of statement is that? But when you think about the situation that you're describing, don't do nothing is the best way to put it. It's the easiest way to put it. Don't do nothing. There's options out there. There's help. There's so many resources you can check out. 988 might be the best one to start. Local crisis centers like Carbon-Monroe-Pike might be one of those places to go. I think that's the perfect spot to leave this one, is don't do nothing, whether it's for yourself or for somebody else.
I like
it.
Don't do nothing. I know that you thanked Tina already. Tina, I would like to do the same. Thank you so much for joining us today.
Of course.
An awesome conversation, and would love to have you back anytime. So thank you for talking to us.
Thanks so much.
Thanks, Crockett.
You got it. She is Tina Clymer and the always amazing Amie Alanson Dundon here with the Just Start the Conversation podcast. It is brought to you by St. Luke's University Health Network. You can find us on YouTube, Spotify, Apple Podcasts, wherever you're getting your podcasts, or check it all out right at sluhn.org.